Sylvia has accomplished a great deal over here while she's been working away. That's what the thumping is. That's what the thumping noise is. She's made two full sets now of the liver drop copies.
Of the heavy metals out is what she was specifically making.
Heavy metals
and
out.
Since we have 2 jaundice cases at the time,
Uh-huh.
just at present,
Mm-hmm.
we will have a spare set of heavy metals out of liver.
I see. Okay. Well,
And then the next detail that we were going to show the audience here is how we would take mercury out of the blood in order to get the bilirubin oxidase back. Could you do that, Sylvia?
Yes.
Show how you would take mercury out of the blood.
How did I what?
How to make drops called take mercury out of the blood. There we took heavy metals out of the liver, and now we're going to take mercury out of the blood. The mercury will be on the left side, the blank will be in the middle, and the location will be on the right side. So the location is the blood. Right. Now, just a minute, we'll review to because we can't see those labels. I want to be perfectly sure that we're taking mercury. It says Hg for mercury on that.
The
The
blanket.
empty blank. Mm-hmm.
Yes.
With the dropper top
And
on.
should we make a master out of that, or should we just make drops? I think we won't make a master. We'll just make that drop.
Okay.
So now we're going to turn on the.
Yes. Turn on the generator for 20 seconds.
Mm-hmm.
And that will put both of those items into that one blank bottle.
Mm-hmm.
And this is a parallel circuitry, so that the mercury and the location are in parallel. Now we'll check and see whether it got done.
She just completed the 20 seconds and did it very appropriately. One of the points that people need to know is when they turn off the generator, they need to be sure that they turn the generator off before they touch the item that they'd copy, otherwise they negate the value of the copy.
I'm now looking in the new bottle that Sylvia just made, and it needs to have blood in it. And it does, because it's resonating. And it needs to have mercury in it. And it does. And they were put in the parallel circuitry. So this is correct. It can
Good job, Sylvia. You get an A.
mercury out of blood.
Yeah.
Now, how about making 2 copies of that, so that we have 3 altogether, because we have 2 patients and we need to have 3 bottles just in case one of them.
So what she's doing now is making up a label, because after you make a copy, you need to immediately put a label on it so you don't get confused. And so she's putting a label on it and then putting some tape on it to keep the label there. And the label should go high on the shoulder of the bottle, so that when you make a copy of it or you put that on the synchrometer, the label is not being copied as well.
Yes, now she's making 2 out of that one, making an extra 2 copies of that.
So she took the one that she just made, put that in the middle, and she put 2 blank bottles on the 2 opposing ends with all of those touching one another, and giving it now 20 seconds on the clock, so that she can have 2 additional samples, since we have 2 bilirubin cases, 2 liver cases on our hands. Very good. Now we'll test those just as we did earlier.
Thank you.
It's a very critical thing, so we want to be very sure that they have copied.
Yes, good.
There's
This is
a little chance that it wouldn't, but we don't want to take even that little chance.
This is
Too
one of the new
important.
bottles that just had water in it,
Mm-hmm.
and now it has mercury out of blood in it.
Mm-hmm.
You might think that, well, this is identical, and we don't have to test it, but we do it anyway.
You bet. You
The
bet.
risk is not worth taking.
Mm-hmm.
Yes, they're both good, and they can be labeled.
You know, it tickles me, Dr. Clark, to think that some of the opposition out there thinks that this might all be hocus pocus, and yet when I work with you and I see you do, 600 or 1,000 tests a day, and I look at your finger from the work you've done, and I think, my goodness, why would you be doing this as an intelligent person if it didn't work? That's asinine. Actually, they need to take a few minutes and educate themselves as to the science behind this. If they did that, they wouldn't be blasting you all over the place. But they do because they don't know what's going on. So I'd like to see that we can perhaps let some of these people know that what we're doing is real science.
Yes, and I would also like to point out how fast everything goes. The body acts much more quickly than we ever thought. Imagine it, getting rid of its heavy metals in 1 to 2 days, getting rid of the fungus in it, getting rid of the extra aflatoxin in it. Now, if we had a case as bad as, say, a bilirubin up at 9 or 10, we would also take aflatoxin out. Because we know that aflatoxin is the
It's
real
going to be there.
toxin, and it won't come out fast enough by itself. We would just take aflatoxin out of the liver, each one of those spots, and aflatoxin even out of the blood, because there would be so much aflatoxin in the body at that point that the patient would be sick in bed, not wanting to eat, vomiting, all those things you see in terminal cancer in
Liver
jaundice case.
trauma.
It's a very miserable death.
Boy, how true.
It's a miserable kind of cancer death.
You
It
bet.
isn't necessary. Look how quickly we can pull a person out of such
And
deep trouble.
Some of those people, and there was just a person recently in the U.S. somewhere waiting for a liver cancer, a liver
waiting
transplant,
for a liver transplant.
and passed
Right.
away because one didn't show up.
Yes.
And yet that person
Yes.
could have very well followed this procedure and
Yes.
saved themselves
Yes.
if the world had
Jaundice,
accepted some of
you
this.
were asking earlier, why does jaundice happen, or when does it happen? It often happens when the liver has a lot of junk, garbage in it, from having killed a lot of parasites, and from having treated your hepatomas. That's probably the biggest cause. When the liver is full of cancers, they're often roundish shaped things, not perfectly round, but roundish. They're called hepatomas. Each one is a malignant area, and after you kill it with either radiation or chemo, it dies. What's there to remove the toxicity of that dying tissue? That's one of the considerations that clinical oncologists have in mind when they say, no, this is not a case for radiation or chemo or something. They know that the patient is likely to die if that method were used. And often leads to jaundice then, even if it's not, they try not to have that happen, but often it can't be helped. And no amount of digestive enzymes, which was an early
Standard procedure.
yes, and you would even inject digestive enzymes right into the tumor. But this is much faster and easier. You don't need a very high tech solution. This isn't really high tech, what you see here. Maybe the discovery of it and the technique of it is certainly much more advanced than what we have, but it's still not what you would consider difficult to build or to do, and therefore I don't consider it high tech.
As I recall, you when you invented this thing, a synchrometer, you put it together with about $60 worth of Radio Shack parts. And here's a hobby kit right in front of us, this unit here. I'll pan in on is a Hobby Kit 200 sold by Radio Shack initially for about $65. We've had trouble finding it lately because I think it got pulled off the market because of the fact that we were doing too many good things with it. And then there's the plate adapter here that completes the synchrometer, and the design, the diagram and everything is in public domain, and it's in all of her books. She has about 7 books out there. There we go. Thank you, Dr. Clark. You've been a great asset to this planet, and I hope that someday the world recognizes what you've done here.
Thank you, Kirk, for spending your afternoon giving us a great video. I had a pleasure making it because it's such a pleasure curing these jaundice cases.
You bet.
And Sylvia, thank you for being here and keeping up the practical end. Without that, nothing would be happening.
Thanks, Dr. Clark.
You did a good job, kiddo, and look at all that good stuff you put together there. And that's enough to save a patient's life. Thanks kindly. We just looked at Sylvia there. She's got a really pretty face. Yeah. Thanks, Dr. Clark.
You're welcome.
We'll see you all in the morning. Adios.